Peptides are a really exciting type of drug because rather than treating a disease once it's already taken hold, peptides can optimize different processes for the body and improve our performance, improve our well-being, and potentially prevent disease before it takes place. So today I wanted to tell you a little bit about growth hormone promoting peptides. So growth hormone is something that we produce a lot of as children. Children need growth hormone to grow, to become tall. And as we get older, the amount of growth hormone we produce goes down, but we still need some growth hormone. And growth hormone is really important for muscular recovery from exercise, exercise tolerance, sleep, and energy. So most of our growth hormone is produced during the night between the hours of 10 p.m. and 2 a.m. That's why it's really important to actually be asleep during those hours to produce your optimal amount of growth hormone. It's hard to check growth hormone directly in the blood, but we can check something called insulin-like growth factor 1, IGF-1, which is a good analog that tells us where someone's growth hormone is. So we have 3 really cool peptides that allow the body to produce more growth hormone on its own. Taking growth hormone that's produced synthetically is not safe, and I don't recommend it. But using these peptides that encourage your body to create more growth hormone on its own is actually very safe and has had amazing results in a lot of people. So the people who may benefit from peptides that encourage growth hormone secretion are people who are struggling with exercise tolerance, who want to be active, but they feel very tired, very drained. They cannot take heavy exercise. People who are having trouble with sleep, people who are having trouble putting on muscle, and people who are lagging energy. So I want to tell you about 3 peptides that promote growth hormone secretion and tell you a little bit about each and how I usually decide which one I will put someone on. So the one that's most well known is something called Sermorelin, and this was FDA approved. Unfortunately, not all peptides are FDA approved, but Sermorelin is FDA approved, and it was initially approved to help children with short stature. And it is the mildest and most gentle growth hormone promoting peptide. And it works well for some mild anti-aging effects, for some improvement in body composition, so reduction in body fat and increase in muscle. And it can also help for sleep. And it's the least expensive of the growth hormone producing peptides. So it's very safe, very well tolerated, least side effects. It's probably the least intense of all of them, but very well tolerated and a good one to start with often and least expensive. The next one that I really like is Tesamorelin. Tesamorelin is also FDA approved, and it is FDA approved for the reduction of visceral fat. So you might have heard about good fat and bad fat, that we have fat that's underneath our skin, that fat that you can actually grab in the folds, and then there's fat that's around your organs, the men who have beer bellies that are kind of hard and you can't really grab those folds of fat, that's visceral fat, that's fat around the organs. And Tesamorelin is fantastic at just sort of melting that fat and helping you produce muscle. It's a little more expensive. It is also FDA approved, and it also helps build muscle. And then the last one that some people are familiar with is CJC 1295 with Ipamorelin. So this is a combination of 2 peptides, and they work in slightly different ways, both to raise the growth hormone level. This is the best peptide for athletes and for people who are really trying to put on muscle and really want to enhance athletic performance. It's probably the most intense of all of them. It has the most potency. And this one, unfortunately, is not FDA approved, but it is available for off-label use. So all these peptides are injectable, and most of them require an injection at least 5 times a week in the evening, away from food. You want to make sure you haven't eaten anything for about 45 minutes. And we usually cycle them for a period of 3 months on, and then at least 3 months off, depending, of course, on the person and what their needs are. So peptides are very powerful, very interesting, and I hope you come see us if you are interested in learning more.